Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi, and in this episode, I'm excited to talk about this topic. So this is a topic that really affects a lot of people every single day, and you don't even realize it. The topic that we're going to be talking about is sciatica. So whether you're experiencing pain yourself or you know somebody who has it, this condition can be debilitating. In today's deep dive, we're going all the way, exactly all the way. We're going to tell you exactly what sciatica is, what causes it, how it impacts your life, and what the available treatments are, both conservative and non-conservative. Plus, we're going to go over understanding some new pretty cool therapies, I think, to try to help with this condition. So if you've been struggling with pain or curious about this condition, this is the episode for you. So let's get started. Okay, so what is sciatica? Sciatica refers to pain that radiates along the pathway of the sciatic nerve. The sciatic nerve is the longest nerve and largest nerve in the human body. It's critical for a lot of different things. This nerve originates in the lower back, in the lumbar spine. It travels through the pelvis and branches into each leg, all the way down into your feet. This nerve plays a crucial role in motor and sensory function. Basically, when I say motor and sensory, what that means is the ability to move your leg muscles and the sensation of it. So the term sciatica describes symptoms, not a diagnosis. Aha, you didn't know that. It is often signals of an underlying condition. Most often, sciatica occurs on one side of the body due to nerve compression or irritation of the sciatic nerve. So some of the key features of sciatic nerve are pain that goes down the lower back, through the buttocks, down the legs, sometimes the foot, unilateral. Most times it's one side. The pain could be mild to debilitating. While sciatica itself is a set of symptoms, again, it's not a standalone diagnosis. It's important for you to understand because sometimes people say, what's your diagnosis? Oh, I got sciatica. No, your symptoms is sciatica. Your condition is blah, 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 right? It could be a lot of different things. So let's talk about it. So people use that term as a description. So the term is talking about pain that radiates along the sciatic nerve path. You could have tingling, you could have numbness, you could have muscle weakness in the affected leg. These symptoms usually track back to an underlying condition, such as herniated discs, most common, spinal stenosis. Spinal stenosis is narrowing of the spinal cord, piriformis syndrome, spondylolisthesis, or other structural problems. So here's a question that you might ask. Well, doc, who does sciatica affect? So sciatica is incredibly common. It's affecting about 40% of the people during their lifetime. Certain age groups are definitely at a higher risk, and lifestyle factors and physical conditions are important. So let's get into it. Age. Typically, sciatica affects people between 30 and 50 years old. As the spine ages, wear and tear issues like herniated disc, degenerative disc disease increase over time, making nerve compression more likely. Lifestyle factors. Sedentary lifestyles, prolonged sittings, or poor posture can strain the lower back and irritate the sciatic nerve. So you just saw me do that, right? So I said sedentary lifestyles, poor posture. I just sat up straighter in my chair because I'm like, wait, I'm sitting back a little bit. Let me sit up properly. Next, about lifestyles, we're going to talk physical demanding jobs, occupations. So if you have a heavy lifting job where you're going to be twisting, turning, you're going to put your back in a position for injuring the sciatic nerve. Excessive weight. So anytime you have excessive weight and you put an extra load on your spine, you can raise the likelihood of herniated discs and other conditions causing pain and problem. Another area that affects for sciatic nerve is pregnant women. So pregnancy can lead to the sciatic nerve compression due to posture changes, ligament laxity, and the baby growing inside, causing pressure on your pelvis. Lastly, athletes. So high impact sports or improper training techniques can irritate the sciatic nerve. Activities like running or weightlifting are often causing lower back pain. So, Doc, why is sciatica so common? So sciatica's prevalence is attributed to three main factors: biomechanics. The sciatic nerve travels through vulnerable areas from the lower back into the pelvis, making it very prone to structural abnormalities, inflammation, and injury. Next is, again, modern sedentary environment. People don't move anymore. Prolonged sitting, improper ergonomics, increased pressure on the lower spine where the sciatic nerve originates. Aging population, degenerative changes in the spine, such as disc wear and bone spurs, increase with age, making this condition that causes sciatica way more prevalent than previously. Okay, so now you have a little bit of basics understanding of who's getting it, how do you get it. Let's understand now the anatomy. We're gonna put on I'll put on my little bit of a geeky hat, and we're gonna go a little bit deep in the anatomy of it. So to really understand sciatica, you need to really understand the anatomy and the function of the sciatic nerve. Again, it's the longest and largest nerve in the human body. This typically makes it responsible for many functions, particularly in the lower extremity. So the anatomy. The sciatic nerve is formed by the nerves in the lumbar spine and the sacral region. And what happens is, so in the spine, the nerves begin with contributions from 5 different nerve roots: L4, L5, lumbar spine, L4, 5. And then you go into the sacral spine, S1, S2, and S3. All these nerves merge and from the spinal cord through gaps in the vertebrae, and then that's how they form the sciatic nerve. So the pathway, it's pretty crazy. This pathway is, after forming in the lower spine, the sciatic nerve travels downward into the pelvis. Once you get into the pelvis, then it's going to go through the pelvic cavity. Once you go through the pelvic cavity, it's going to run through all right, so here's one that you're going to want to pay attention to. It's either going to run through or under the piriformis muscle. The piriformis muscle is a small muscle in the buttocks. So if your glutes are here, your glute muscle's on top, your piriformis is underneath it. And what happens is your piriformis muscle could be under here, and then underneath that is the sciatic nerve. It's either underneath that or through it, one or the other. Some individuals make the anatomy difference, and that's why this sciatic nerve passes through. It's only going to affect about 6% of the people, where it's going to actually pierce the muscle and go through the piriformis. If it goes through the piriformis, it's much easier for that muscle to clamp down on the nerve. Once it leaves the piriformis area, it's going to go into the thigh, from the buttock, it goes down the back of the thigh, traveling beneath the muscles like the glute max and the hamstrings. After that, it's going to branch at the knee. So when it gets to the knee, it's going to split into 2 major nerves: your tibial nerve, which travels down the back of your leg into your foot, and your common peroneal nerve, which wraps around the outer part and travels down the shin to the top of your foot. Size and reach. All right. So again, this nerve is about 2 centimeters wide at its thickest point. You might say, Doc, 2 centimeters, what is that? That is, in nerves, that's a giant. That's an anaconda. It is huge. It's the largest nerve. And because it's the largest nerve, it typically innervates a large portion of the lower body, including the glutes, the thighs, the lower legs, the feet, and the toes. Okay, so now you know the anatomy. Function. What's the function of the sciatic nerve? The sciatic nerve is a mixed nerve. What does that mean? That means it's both motor and sensory, and they are going to function throughout the lower body. So motor function. The sciatic nerve controls many muscles that require movement in the lower extremity, including your thigh muscles, your hamstrings, muscles that allow you to bend your knee, lower leg muscles that controls you to allow to flex and rotate your feet and toes. Sensory function. The sciatic nerve transmits sensory information from the skin to the brain. That includes touch, pain, temperature, pressure. These sensations are transmitted from the thigh, lower leg, and foot back to your central nervous system. The sciatic nerve is vulnerable during a few different structures, and here is exactly why. Because it's so big, and because of how big it is, its pathway makes it vulnerable to compression and strain in several locations. So because its proximity to muscles and bones, and you're passing through tight spaces like the piriformis and in the pelvis, makes it very susceptible to entrapment syndrome. Also, spinal stresses. Listen, modern day people are sitting at their desks for hours on end, and they don't move, they don't exercise, they don't get out there and do different things. When you do that, your modern sedentary lifestyle can cause pain and pressure. Another problem is when people sit with their legs crossed. It's going to cause a problem in your lower extremity. So next segment we're going to talk about is, Doc, what does sciatica feel like? I heard this term. I don't know what it is. What does it feel like? So sciatica is well known for its intense discomfort that can cause severe pain, but it also can cause mild pain, right? Some people experience very mild aches, while others feel sharp, debilitating pain that interferes with every aspect of their life. Let's break it down a little more. Primary symptoms of sciatica are caused by irritation or the compression of the sciatic nerve, and it can manifest in a few different ways, depending on the root of the problem and the exact area that the nerve is affected. The hallmark symptoms of sciatic pain is radiating pain, radicular pain. So pain that often begins in the lower back or buttocks, follows the sciatic nerve down the back of the leg into the calf, foot, or even toes. It is not the pain that goes into the front of your leg. Again, it is not the pain that goes into the front. It's in the back of your leg. You can have it towards the side, but not the front. You can feel mild pain to burning, electric-like shock sensations. People often describe sciatica as shooting pain, radiating, stabbing, relentless throbbing pain. Typically worsens with activities like walking, standing, or bending, or prolonged sitting. You can also have tingling or pin and needle sensations. Why do you get pins and needles? That's different than the burning and the sharp radiating pain, right? So the first part is more motor nerve. The tingling, pins and needles are more sensory, right? So it refers to abnormal signals by compression of or inflammation, typically in the buttocks or feet. So typically when the sensory fibers become irritated, it can create a prickly crawling feeling without direct external stimulation. You could also have weakness or numbness. So your muscles could feel weak. You could find it difficulty to lift your leg or move your leg. You might have numbness where you don't even feel your leg, right? You can hit it with your hand and you don't even feel it. So let's go over the patterns, right? Because nerves have very, very specific patterns. Weakness often correlates to specific nerve roots. When we're doing part of our testing, we're testing specific muscles to determine what's compressed. So for example, if you're having difficulty lifting your foot during walking, aka foot drop, that could be an L4 compression. If you have weakness in your toes, bringing your toes up, or ankle movement, could be an L5 compression. If you have difficulty with calf muscle strength, and you can't go on your tippy toes, that could be an S1 compression. Numbness and weakness often coexist, appearing in specific zones along that sciatic nerve pathway. Sitting discomfort. What does it feel like? So sitting for extended periods of time often worsens sciatica. Persistent pressure in the lower back and hips can aggravate the nerve, causing compression and leading to pain. When you sit down, you increase the pressure in your spinal cord 5 times. When you sneeze and you hold it in, it's 10 times. It's a lot. When you're seated, the sciatic nerve can be compressed near the spinal column or the piriformis muscle, which is going to increase in the inflammation. So the triggers for that are prolonged sitting, long car rides, sitting with crossed legs for extended periods of time. I know multiple people who sit with their legs crossed. I tell them, well, they don't listen. They're very, very stubborn. This is how they sit, and this is why they have back pain, and they know who they are. Got to get you got to sit with proper posture for your biomechanics, right? Your legs have to sit in a normal sitting position. That's all I'm going to say about that. Okay. Symptoms exacerbated by movement. So sometimes if you go from sitting to standing or you change positions, again, sneezing or coughing, that can intensify the sciatic pain. People can feel sharp jolts or shooting pain as the nerve compressed by the abrupt movement. This happens because the increase in abdominal or back pressure during the movements can strain the nerve and worsen the already inflamed area. Some of the secondary symptoms of sciatica can include muscle cramping, altered gait, sleep disturbances, right? So altered gait, maybe you might limp because you're walking funny. Sleep disturbances, you can't find a comfortable position. You're getting muscle cramps. You get pain in your calves, and you're putting yourself in bad positions. All of it can cause some of those secondary symptoms. So the severity, again, let's break it down a little bit more. You could have mild cases where you have occasional aching in the lower back and buttocks, some slight tingling or dull pain in your lower back or buttocks that typically resolves with rest and movement. Moderate cases, you could have ridiculous pain down the leg that interrupts activities or sleep, persistent tingling in the foot, and in severe cases, you could have excruciating pain that affects the way you walk, sit, or stand, muscle weakness, foot drop, and a variety of other conditions, right? So as you get worse, your conditions get worse. Again, let's go over, I think it's worth repeating so you understand if you're getting pain and numbness. L4 compression is pain and numbness in the thigh and medial lower leg, right? So your thigh and medial lower leg. L5, nerve root compression, lateral leg and top of the foot. S1 compression, buttocks, down the back of your leg to the bottom of your foot. I'll have patients that come in and say, Doc, I got pain down my leg in the bottom of my foot. It's not in the heel, so it's not plantar fasciitis. It's in the bottom of the whole entire foot. So how does sciatica affect your life? So whether you have mild or severe pain, the effects can be physically, emotionally, and socially draining, right? So your physical restrictions, you can't walk properly, you can't bend, you can't sit, you can't do your daily tasks, you can't hopefully exercise, right? Hopefully you're exercising. You might have sleep disturbances. Again, you can't find a great position because you have pain every time you twist and move. Emotional strain. When you have chronic pain that can lead to anxiety and depression. Work limitations. Maybe you have to lift at work and now you can't do it because you can't sit, stand, bend, lift, twist, and lift any kind of weights. It's important to get this under control. So understanding the symptoms, understanding the triggers is important for you to learn how to deal with it. So, causes of sciatica. Again, we talked about this a little bit, but the main cause is a herniated disc, typically at L4 or 5. Again, piriformis muscle compression, pelvic injury, compressions to the knee where you're going to affect the spinal canal, placing pressure on the nerve roots, causing the pain and numbness, the weakness, and all that not so fun stuff. Next is spondylolisthesis. This condition occurs when one bone slips in front of the other bone. It slips either forward or back, right? So there's a retrolisthesis and a spondylolisthesis. If it's retro, that means it slipped to the back. A regular spondylolisthesis. Okay, so it's called anterolisthesis or retrolisthesis. So they're both spondylolisthesis. So, all right, I'll give you the full story. So retrolisthesis means it's shifted back. Anterolisthesis means it's shifted forward. The general term is called a spondylolisthesis. And when your bone has shifted from one to the other, that can narrow the nerve root space. And when you do that, that can cause compression of the nerve. Piriformis syndrome, again, we mentioned that before. We went over that. That's the muscle in the buttocks. It's either 6% of people have it where the nerve goes through the muscle. It happens a lot that people are, and it's one of my definitely, I want to make sure that it's a differential diagnosis for patients, especially if they're getting pain in there. I'm always checking that piriformis to make sure if compression is happening there or above. It's one of my triggers that I definitely do every single day. Injuries, right? So sciatica. Can you get an injury from sciatica with a trauma? Yes. Falls, car accidents, sports injuries, direct damage to your back, pelvis, or legs can cause sciatica. Bone spurs, right? So overgrowth of bony structures in the vertebrae can be caused by arthritis, can lead to compression in the areas where the nerves are coming out, and then that can pinch on that nerve, causing pressure and pain. Again, we mentioned this before. Degenerative disc disease, you wear your disc out, the disc compression, put pressure on the nerves. Pregnancy, tumors or infections, poor posture, especially these days. How do you diagnose sciatica? So typically, the way I typically diagnose is I'm going to take a great history. I'm going to do an amazing exam. I'm going to definitely do all my ranges of motion, all my muscle testing, all my orthopedic testing, all my neurological testing, put it all together, and I'm going to start having an opinion. I might take x-rays to see what your spine actually looks like. If I can't get any answers there,